Hi, I'm Kathy, and my husband and I have been married for 38 years. In the last 5 years is when I had to focus more on being his caregiver. But with months after his transplant now, I'm able to forfeit that title because his transplant was so successful. As you can see, it's an emotional process. I'd like to share some of the learnings that I have as his caregiver for someone with CF that also went through a lung transplant process. That is just, the lung transplant process was just a miracle for us. As he got sicker, I was lucky that I was now retired and could spend a lot of time with him because being a caregiver takes up a lot of your time. When he went into the hospital for all of his exasperations and later after the transplant, I was able to spend days and nights with him in the hospital to be able to be by his side. He was always comforted by my presence being there, and he always told me that that helped him in his recovery process. Since I was with him all the time during hospital stays, I learned to be his patient advocate. Very important role. As his health declined, he was in the hospital a lot more often. I had to balance between being his wife and being his patient advocate. I also started going to his regular CF clinic visits so I could be informed. During his hospital stays, I kept logs in a notebook to keep track of doctors, nurses, drugs, medications he was taking, comments or questions that I have until the next doctor visit would roll through. I journaled everything. This was particularly helpful during his hospital recovery days after the transplant, which is so hectic and full of activities. There's always somebody coming and going. And you're on a lack of sleep. So stay rested, sleep when you can, but you have to be present. Be ready for lots of physical help. I was a Sherpa. As Willem got weaker, he was on oxygen. And while he carried his own POC, his personal oxygen carrier, concentrator, named Charlie, I was his full-time Sherpa for everything else. So stay physically strong and healthy for yourself so you can take care of that loved one. Get connected with a support group. As transplant process loomed closer, it was important for me to get informed, to be prepared, to learn what was going to happen in the future during this journey, the ups and the downs. So the lung transplant support group at our transplant facility was fantastic. And everybody was so open and friendly, caring, willing to share their experiences with us. I found lots of information here that was a great comfort and really an extended family that could help me pull through the next few months. Pack and plan ahead. When the boys were young, I was a scout leader, so our motto was be prepared. Remember to make a list and of all the things that you think that you'll need, run it past the lung transplant support group. They've been down this road. They can give you added tips. Once you have that list, pack it and be ready to go. Remember that a lot of the calls that you get might be a dry run. And in that case, focus on bringing the basics and then have a plan set up for people to follow up and bring what other items that you might need. Other family members or friends that can bring that to you. For household financial planning, I transitioned all of our bills to online bill paying. That way, since we were going to be away from home, I did not have to worry about anything being mailed or people delivering, family or friends bringing mail to me or bills for me to worry about. I could just get the notices online and be able to pay them online, set up through my banking system. So it didn't matter where I was at that time. Transplant house planning. So afterwards, you need to have a transition plan to be able to continue your care but still stay local to your transplant house. So you want to find a place that's close to your transplant facility and know where you're going to go, whether it's going to be a condo or a friend's house, family members, a hotel. Consider what you're going to need to be comfortable in that facility. For example, my husband, he loved his favorite espresso maker. And so I made sure that that came with us on our trip. Surgery visuals. Surgery and medical conditions don't really scare or upset me. But even so, seeing him intubated with chest drain lines and IVs and tubes everywhere and monitors beeping was a little uncomfortable. But if you're queasy, be ready for some potentially upsetting visuals of your loved one. He doesn't even like looking at the pictures that I did take of him on the ventilator when he was intubated. Cheerleading during recovery. I encouraged him to start walking as soon as possible. He was motivated, but my extra push really got him going. I helped get the nurses into the room for the first walks, helped them navigating and getting him up. As he got stronger and we walked longer and longer, I helped track his walking distances and how many times a day he walked, things like that, just to give him the motivation to keep it going. Camera, you ready to rock it?
Wait, are you videoing?
Yeah, I am.
Okay, we're going for our first walk.
Woohoo!
New lungs. Gonna go jog a marathon.
Jogathon? Great.
Kathy.
One for a stroll.
No hands.
No hands.
Oh gosh. Oh.
Illegal, illegal.
Doing amazing. Very happy. Best birthday ever.
Head for the exit.
Medications organizer. Wow, there are a lot of different medications to organize after a transplant. Many of these will diminish over time, but it's easy to get overwhelmed when first discharged from the hospital because, of course, they're life-saving meds. One real test for us learning together was when he got his medically induced diabetes and how to monitor blood glucose and administer insulin. So he didn't want to give the shots to himself, so I gave it to him. Have a support team for yourself. If you have friends and family local to the transplant center, great. Make sure they know that you need their help at very little notice sometimes. Hey, we got the call. Can you come help? We're packing the car. Or maybe I need help right now because something distressing is going on and I need somebody to be here with me. Some people helped us pack the car after getting the call, and as Willem was unable to help because of his lack of oxygen abilities, and I was a basket case, so they came over and helped us pack the car so we could get ready to leave. Other friends came later and delivered things that we had as a second run of items that we needed. So they met us and delivered that. Other things that helped me, support me, were people would bring me lunch when I was at the hospital so I didn't have to leave the room, or I could leave the room for a little bit just to see somebody else, or deliver dinner to the hospital because we all know hospital food isn't the greatest. You need to take care of yourself though, and be strong for your loved one. Local friends and support was pretty critical for us. We created a meal train. This was before we actually had the transplant, when he had so many hospitalizations, and it just took the stress off that I could focus on him and keeping him healthy. He needed really hearty meals with lots of calories, and luckily he likes good old-fashioned home cooking, and he enjoys those kind of meals. So with a little coaching, I would tell people what they wanted, and so we set up an actual online program, a meal train, to be able to have those come in. That helped me tremendously. And then you also want to have people who might come in and help with gardening or help with house cleaning or plants or getting your mail or something like that. Think about who will care for your pets. Those are all things either pre-transplant or post-transplant that you'll need to walk through. Establish a communication vehicle for family and friends. We primarily used CaringBridge. Everyone wants to know how the surgery went, how things are going, how's the recovery. Many don't understand that it's not a 2-day surgery. It's a multi-day, a couple of weeks, high-stress endeavor. And my priority is him. You won't have time for multiple individual repeating texts or emails or messages to people. So prior to the transplant, we set up a CaringBridge journal online, which is accessible to those that we added and approved of. He wrote many journal entries while he was ill after he got listed to keep people informed. And then once we got the call and then the surgery happened, I took over journal entering. I didn't have to call or text anybody because it would automatically let people notified that there was a new update that they could read. I also had a couple of contact people that I would send a message to, and then they would then send that off to other people to keep them informed. A little bit more personal, but that way I didn't have to send out to the 10 closest people that I needed to be informed. Having that ability to spend the time with him rather than spending it going through emails and texts was a real helpful. And I wanted to turn off my phone so that I wouldn't disturb him too, as he was maybe get a brief moment of a rest. Let me summarize the key caregiver learnings. Caregiving takes a lot of time. Be a patient advocate. Stay in shape for your Sherpa duties. Get connected with a support group. Pack and plan ahead. Plan for your transplant house. Be ready for visuals after surgery. Be the cheerleader and motivator. Medication organizer. Have your own support team. Get local friends to help and support. Establish a communications plan. The transplant journey is a challenge, but so worth it. But it takes a team. He's always talking about how he couldn't have done it without me and my support. And I couldn't have done it without all my backup and support. So get prepared, be ready. It's a journey, but it's an amazing ride.